So now let's move on to the next, that is the cutaneous route of drug administration. So guys, cutaneous means skin, okay, and if I say that subcutaneous, so that will become the underneath skin, okay, underneath skin. So guys, check out my video on tetanus, okay. In that I talked about the dermis, that is the skin layer, okay. Now on superficial surface of skin is the application site, and the example is thyroxine patches, and then we have is the nitroglycerin patches. So guys, thyroxine, as you know, is a hormone produced by the thyroid gland. It helps in variety of metabolic process, like it regulates the metabolic rate of the body, and it helps in the brain development, digestion, and many more. That is what is the thyroxine usage. Next we have is the nitroglycerin patches. So guys, here now you see that we have a nitroglycerin sublingual and nitroglycerin cutaneous, that is into the skin. So guys, both this thing do the same function, but the mode of route is different. That is, here we use as the patch, and here we use is the sublingual tablets, okay. That is the nitroglycerin patches. So next we have is the inhalation. So guys, in the inhalation, the application site is, it is inhaled as volatile liquids and gases. So guys, volatile means that a liquid which evaporates or vaporizes in a low temperature also, okay. The example is acetylene. So guys, acetylene is a brand name, as you know, and it contains salbutamol, which is a bronchodilator. That means it dilates the lung airway and the passage, okay. And it is useful in variety of like diseases. For example, it is used in treatment of chronic bronchitis, number 1, and also in the COPD, that is chronic obstructive pulmonary disease, is the acetylene, okay. So next we have is the nitrous oxide. So guys, nitrous oxide, it is an sedative, that is it induces sleep, and it also help in reducing the anxiety, okay. So guys, in dentistry also it is very much used, nitrous oxide, as an inhalation anesthetic medication. Write it down: inhalation anesthetic medication, extensively used in the dentistry. That is the nitrous oxide. Next we have is the nasal, that is the application site is by the nasal airway as spray or nebulized solution. So guys, nebulized solution means that the liquids are turned into thin mist of air by the machines like nebulizers. That is what it means, okay. The examples are desmopressin, and then we have is the GnRH, that is gonadotropin releasing hormone agonist. So guys, desmopressin is actually an anti-diuretic hormone, that is it helps in the retention of water from urine, and also it prevents too much urination. That is the use of desmopressin, okay. Actually what happens is, it is an alternative of the vasopressin, which is a pituitary hormone which is produced naturally into the body, but if that is not produced in a quantity of required amount, then we use the desmopressin, okay. So guys, next we have is the GnRH, that is gonadotropin releasing hormone. So let us try to understand this as well. So guys, GnRH agonist. So guys, GN here means gonads, that means organs which produces the sex gamete. So in the male we have the testes, in the female we have is the ovaries, right. So guys, that means these hormones, they stimulate the action of testes and the ovaries. So what happens, first the hypothalamus is where the GnRH is released. So we say release of GnRH, okay. Now as the GnRH is released, it stimulates the release of LH and FSH from the pituitary gland, okay. stimulate release of LH and FSH. Okay, now this LH and FSH, this is the hormones which regulates the ovary and testes. That means the GnRH is indirectly regulating the ovary and testes. Okay, now if I say it is an agonist, that means in this case the ovary and testes, that is the production of the hormones, that is sex hormones, like in this case is estrogen, progesterone, here is the testosterone, that is suppressed. That is GnRH agonist is suppressing the release of testosterone and estrogen and progesterone. That is what the GnRH agonist means. Okay, so now let us talk about the next route. Before moving to the next drug route, let us first complete the classification chart, right? So guys, in the enteral we had the oral, sublingual and rectal. Okay, in parenteral we have two categories. So guys, the number one category is the non-injectable, and then we have is the injectable. Okay, so guys, in non-injectable we have the cutaneous, inhalation and nasal, and in injectable we have the following four that is present here, as you can see. So this is number 1, 2, 3 and number 4. So this is the subcutaneous, then we have is the intramuscular, intravenous and intradermal. So in the copy guys, make sure that you write in elaborate manner, that is drug route, local, systemic, topical, deeper tissues, arterial, right? Then we have as the enteral, parenteral, oral, sublingual, rectal, non-injectable, injectable. Here we have as a cutaneous, inhalation and nasal, and then at the last we have as a subcutaneous, intramuscular, intravenous and intradermal. Okay, so guys, the next route we have is a subcutaneous, and the site of the application is beneath the skin. The examples are insulin and norplant. So guys, insulin is a natural hormone produced by the pancreas, and it helps in the absorption of the blood glucose into the body cells. Okay, but what if the pancreas doesn't produce insulin in a definite amount? So what will happen? It will cause a condition that is diabetes. In that case, we use medicated insulins to fulfill the insulin demand. So that will cause the decrease in blood sugar, that is use of insulin decreases blood sugar. Okay, and this artificial insulin also helps in the blood sugar, that is glucose intake into the cells, that is the insulin. And next we have is the norplant, that is it is a contraceptive medication guys. So norplant is a brand name and it contains levonorgestrel as an basic composition. Okay, so next we have is the intramuscular, that is the enlarged skeletal muscles, and the examples are paracetamol and diclofenac. So guys, I have talked about the PCM, it's an analgesic and antipyretic. Okay, the diclofenac guys, it is a non-steroidal anti-inflammatory drug. Okay, that means it reduces inflammation, pain, swelling and many more. Okay, and if you look at the medications like Omnigel, you would find there is written diclofenac sodium at the top of the medication, right? So next we have is the intravenous, that is the superficial vein, that is the veins you see in the hands like superficial vein. Okay, and we use that is saline. So guys, saline is mixture of NaCl, it is sodium chloride and water. Okay, and use of salines are many more, like in saline we use for cleaning of wound. Okay, and we will also use the saline for maintenance of blood pressure, but the most important use is it is used for dehydration, right? And guys, the NaCl that you see here is important because NaCl is the one that helps in the transmission of nerve impulses. That's a very different thing, so I'll talk about that also, that is the sodium potassium channels and everything. Morphine I have talked earlier, it's an narcotic analgesic, it's a pain medication. And next we have is the intradermal, that is into the skin, and the examples are BCG vaccine and smallpox vaccine. So guys, I am writing it here itself. The BCG stands for Basil Armate Guerin. In simple terms, it means it's a vaccine for tuberculosis. Okay, and the smallpox vaccine, it is a vaccine for disease, that is smallpox, which is caused by variola virus. This is all you have to remember. Okay, so I think I have completed all the classifications and all the examples and application. Nothing is left. Smallpox, diclofenac, no, nothing is left. So guys, I hope you have enjoyed the video. So do like, share and subscribe, and comment down below the topics you want me to make a video on. So that's all for today. Thank you and have a nice day.